So GERD refers to gastroesophageal reflux disease. It's very, very common. Millions of people throughout the world suffer from this, and often it's self-limited. Often it requires over-the-counter remedies, and sometimes it requires prescription medication. Long-standing acid reflux, more than 10 years, particularly those over age 50, probably warrants an upper endoscopy. So the symptoms of GERD include heartburn, sometimes chest pain, sometimes difficulty swallowing, sometimes painful swallowing, and that can be to liquids or solid food. Oftentimes, patient will go to the drugstore and try to treat themselves, which is fine because over-the-counter remedies work very, very well. But if it's not successful, again, those symptoms should not be ignored. They should go to their physician. Risk factors or substrates in foods that can exacerbate or worsen GERD include tobacco is notoriously one of the worst. Alcohol can be bad. Aspirin, ibuprofen can be bad. Sometimes calcium can even increase acid production. Sometimes patients will take Tums thinking they're helping themselves, and in fact they're actually noting no change at all, and sometimes even worse. Spicy foods, greasy foods, sometimes tomato-based products can all exacerbate symptoms. Caffeine, chocolate. And so those are the things that we'll talk to patients about steering clear from while we're getting the right level of medication. Typically, the class of drugs will use a proton pump inhibitors, such as Prilosec, for example, to try to control their acid production and control their symptoms. So a procedure to evaluate the upper GI tract, called esophageal gastroduodenoscopy, is an outpatient procedure. It only takes about 10 or 15 minutes. Patient is sedated under IV sedation so they don't feel or remember anything. A lighted scope is passed through the mouth, through the esophagus, into the stomach and first part of the small intestine called the duodenum, and we're looking for any inflammation, anything that's abnormal. And if so, biopsies are usually done right then and there.